Hey guys, Chanel here. Today I would like to shift gears on you and talk about the lower back, particularly a muscle called your Quadratus Lumborum, or for short, your QL. The QL is considered the most frequent muscular cause of lower back pain. So much, in fact, that in any one year, an estimated 10 to 15% of adults have some sort of work disability caused by back pain. It has also been reported that the QL is the most commonly involved muscle with complaints from our troops in the Army. The QL is a stabilizer of your lumbar spine, meaning it is a stabilizer of your lower back, and can also act as a hip hiker, like so, as well as assists in lateral flexion of the spine, meaning it allows you to side bend. This muscle assists when you cough really hard, and if you're barely able to turn over in bed or unable to stand the pain while you're upright or walking, chances are you have some sort of issue with your QL. And dysfunction within the QL can cause scoliosis-like symptoms because of how it's decreasing the amount of space between your 12th rib and your pelvis. You might experience trigger point pain within the muscle tissue, referring down into the glutes and even into the groin area. Today, I'm going to talk about how to manually release those trigger points, as well as how to stretch out the QL. So join me, and we're gonna have some fun, guys. Alrighty, so I have a couple tools. One is a fairly large ball. It's hard, not very moldable. And then the others, if you don't have a ball, oh, there's canned goods, that's right. So what I'm going to be doing first is showing you how to work the trigger points. So what you'll be doing is, let me get my shirt up here. One thing to keep in mind, guys, is to stay away from the spine. If you get anywhere near the spine, it'll hurt, and it just doesn't feel good, so stay away from it. But what you'll do is, in a standing position, you're just going to bring your thumbs, grab your pelvis if you can, or really what we're trying to do is get your thumbs into the tissue. And we're going to be doing some circular motions, just working our way in. If we feel any knot within the tissue, if we feel any referral pain going on, we can even work the deeper layers of that muscle by getting onto the side. And oh my goodness, that left side, I can feel it going all the way to the groin area. But while you are doing this, just keep in mind where you're feeling the tension, where the knots are. So say you don't have a ball and you have some great canned goods at home. So what you're gonna do is being cautious of not going near the spine and staying away from that 12th rib area. Really keep it above your pelvis. You're just going to lay back, roll on the can. You can even go even flat on your back. I have my left foot up, so it's easier to roll. Maybe go on your side. Next, while we're laying on our side, we're going to place a pillow in between our legs, and we want to have a straight line essentially from our leg all the way to here. This is the side lying position. So you want to make sure that the pillow is in between your legs, and you're just bringing the thumbs around, and you're just manually going through. And if you feel any knots, or if you feel any trigger points within the tissue, like, oh, holy cow, there's one right there. This is a much easier way of hitting those areas. You can even hit the more deeper layers of the tissue by following that QL around. You'll be able to feel now the edge, the deeper portions of that muscle. So in order to do this stretch, we're going to have one leg extended out, and then the other leg is going to be tucked up into the groin area. And what we're going to do is face forward, and we'll place one hand down our leg, the bottom hand, and then the outside hand is going to side bend, which is stretching the QL all the way over. We're going to do this on both sides. You can hold this for up to 30 seconds. You can do this in intervals. It's really up to you and how your body is feeling and what it's telling you. Just for the purpose of showing you, I'm going to do some interval. So we're reaching over. If you can grab your toes, that's awesome. If not, reach as far as you can and until you start to feel that stretch. Hold, and then come back. Again, take a breath in and stretch over to the side. Really trying to keep your pelvis on the right side down, on this side down. This is really going to help stretch the QL even further. But guys, I really appreciate you joining, and I look forward to next time. Good luck. Don't forget about the other side, and I can't wait to see you next time. Take care, y'all.